We have made it to the last section of the CPT book. Yay! So this is the medicine section. Okay. Medicine's kind of a catch-all for a bunch of other different procedures or services, mainly services that aren't captured in the surgery section. Okay, and if you'll notice in your CPT book with the tabs, you've got tabs that say VACC for vaccines, or psych, or OPHTH for ophthalmology. Okay, those are all for your medicine section. Okay, so as we go through them, I'll kind of give you some high points. Biggest thing I think in medicine section is immunizations, vaccinations, and those start on page 699. Vaccinations, immunizations require two codes. They require a code for the administration of the substance, and then another code for the substance itself, whether it's a vaccine, a toxoid, whatever. Okay, so two codes. Also with this, you have to know some of these immunizations and vaccines, they have multiple things in them at the same time. So stop here and go to code like 90698. So at the top of page 702, you're going to see it says there's a code out of sequence, okay? But this is what I mean about vaccines having multiple vaccinations in one substance. So if you see something that says a DPT or a DTaP, that's diphtheria, tetanus, pertussis, and polio all in one vaccine. So it's a vaccine for three things, but it's one substance that you're administering. So you're going to have a code for that vaccine, and then a code for the administration. It's not four vaccines. They're putting 4 vaccines in one vial. Okay. So you have to make sure that you know exactly what the vaccine is, and also how it's given, because some things are given in the nose, some are given through a needle. Okay. So you have to make sure, you have to pay attention to how the vaccine's administered. Okay, so here's the things for injections, and here's a good summary of injections and the skin. Okay. Intradermal means within the skin. Intramuscular, into the muscle. Sub-Q means down to the subcutaneous level. IV means in a vein. Okay, so you have to know how far or what part they're putting the substance into. Okay. So the next section that starts on page 703 is psychiatry, psychotherapy. Okay, so that's why you have the psych tab. You also have a dialysis tab. Okay, dialysis starts on page 708. Dialysis is the artificial process used to clean the kidneys or to clean the blood because your kidneys do not work, because the patient's kidneys do not work. So if a patient has end-stage renal disease, that's when they have to go to dialysis, usually 3 times a week for probably about 4 hours. Okay, so if you'll notice under hemodialysis on page 708, there are some guidelines. Okay. And the next thing that you have in this section is you have ophthalmology. So notice for ophthalmology on page 714, these are your eye exams that are done by an ophthalmologist. So you notice that they're done by new patient or established patient. Okay, so those same rules apply as we learned in E&M. Okay, but this is done by an ophthalmologist for eyes. There's also a few other things in here, like your contact lens service, which is on 717. Okay. You have your hearing test, audiological function test, that's on 720. Okay, and then you have a whole section in the medicine section that goes to cardiovascular, and it starts on page 724. Okay, so some things under this section, under the medicine section. Okay, so this is your echoes. Okay, your cardiac caths, which seems to me it probably should be under surgery, but it's not. It's under your medicine section. Okay. Your monitoring services. So if you look at page 731, this wearable cardiac device, there are a lot of guidelines there. Okay. Then you also have in medicine, you also have some respiratory things like spirometry, pulmonary function testing, vent management. So these are the kinds of things that are under medicine and not under the surgery section. Okay, so that's why you have all these separate tabs to use in the medicine section to help you find things faster. Okay. And then you're going to have a tab for health behavior assessment. Okay, so there's some things on allergy, neuromuscular. So this is where your sleep study. This is a sleep study. Okay. Physical rehab, physical therapy, occupational therapy. Okay, this is where all this stuff is found. Chiropractor, acupuncture. Okay, and then some special services, which we won't get too heavy in that right now. Okay, so this is kind of it's kind of a big chapter, but it's, I don't think you should find it all that difficult. Okay, so now we're done with the CPT book at a highlight. Okay, we've kind of just hit the high points of CPT, but we will go into CPT heavy in 205 and 219 because the CPC test really hits CPT. The CPC test hits CPT codes very, very hard. Okay. All right. So don't forget, post your questions on the discussion board. Don't forget to ask questions. Okay. I know this isn't easy. It's different. So please ask for help because I know with you all being online, it's even harder.